When we think about public health, do we consider the importance of our childhood experiences? What if they have a bigger impact on our health than we could ever imagine? Adverse childhood experiences, or ACEs, are instances of stress and trauma during childhood that determine physical and mental health outcomes during adulthood. What exactly does adverse mean? What is adversity? Adversity is also known as difficulty or hardship. People can experience adversity directly from individuals, like abuse inflicted by one person to another, as well as from the pervasive structures in our society, like discrimination from our social, political, and economic systems. So where does this correlation between adverse childhood experiences and health outcomes originate from? This correlation was discovered in the Adverse Childhood Experience Study, or ACE study. From 1995 to 1997, Dr. Vincent Felitti from Kaiser Permanente and Dr. Robert Anda from the Centers for Disease Control assessed childhood trauma in a range of over 17,000 adults. Jane Stevens, founder and publisher of social network ACEs Connection, explains why Drs. Felitti and Anda created the study.
So Dr. Vincent Felitti is a pretty remarkable guy, and he's very curious about why things happen or why they don't happen. So he's at Kaiser Permanente in San Diego, and he was running an obesity clinic for Kaiser patients. And these were people who were morbidly obese, 100, 200, 300, 400 pounds overweight. He noticed that quite a few of the people who were in the weight clinic were dropping out. And he wanted to understand why, and he thought, what are we doing wrong? You know, maybe they're not losing weight. But he looked at all their records and found that every one of them was losing weight. And he couldn't figure out why people who were successfully losing weight would leave. So he brought them in to ask them why they had left the program, and to try to figure out what would have led them to do that. You know, and so he went through a whole series of questions. And then one day he misspoke, and he, instead of asking, how old were you when you were first sexually active, he asked, how much did you weigh when you were first sexually active? And the woman who he was interviewing said 40 pounds, and she burst into tears. And she said, and it was with my father, and thank you for asking. And that just blew his mind. And he thought, maybe I'm onto something here, maybe I should ask that question more often. And so he did, and then he was afraid that he was sort of putting some bias into it, so he had some other physicians do the list of questions. But what was very clear is what he was getting was reports of incest that he had assumed was very rare, and what he was saying was very commonplace. But then he was also finding that people were gaining weight because they thought it was a good defense mechanism, either to keep people away from them, potential sexual abusers, or it made them feel safer because they had been bullied when they were, young, scrawny kids, and they thought that gaining a lot of weight would help them. So he understood that weight was a solution for them and not a problem.
They assessed 10 types of adverse childhood experiences in the study: emotional, physical, or sexual abuse, emotional or physical neglect, substance abuse, mental illness, separation or divorce, incarcerated family member, and domestic violence. They also created a scoring system for ACEs. For every ACE a participant had experienced, they got a point on their ACE score. So if someone experienced physical neglect, no matter how often, they would receive a score of 1. If a person experienced physical neglect and had a parent with mental illness, they received a score of 2, and so on. Then, the doctors correlated the ACE scores with health outcomes. Dr. Nadine Burke Harris, founder of the Center for Youth Wellness in San Francisco, is a leading medical professional on adverse childhood experiences. In this segment of her TED Talk, she describes the results of the ACE study.
What they found was striking. Two things. Number one, ACEs are incredibly common. 67% of the population had at least one ACE, and 12.6%, 1 in 8, had 4 or more ACEs. The second thing that they found was that there was a dose-response relationship between ACEs and health outcomes. The higher your ACE score, the worse your health outcomes. For a person with an ACE score of 4 or more, their relative risk of chronic obstructive pulmonary disease was 2.5 times that of someone with an ACE score of 0. For hepatitis, it was also 2.5 times. For depression, it was 4.5 times. For suicidality, it was 12 times. A person with an ACE score of 7 or more had triple the lifetime risk of lung cancer and 3.5 times the risk of ischemic heart disease, the #1 killer in the United States of America.
Why does this relationship exist? Why does childhood trauma lead to negative health and social outcomes during adulthood? The answer lies in how stress affects the developing brains and bodies of children. Let's look at 2 children. We'll call them Child A and Child B. Child A grows up in an environment where adults are unsupportive and dangerous. Child A experiences traumatic and stressful events on a regular basis. Child B grows up in an environment where adults are loving and supportive. Child B experiences stress occasionally, but feels safe most of the time. These children's brains will develop based on their unique experiences in each of their environments. Our brains are wired based on sensory experience. Neurons are cells in the brain that transmit messages throughout the body. They make connections when they receive or send information. Jennifer Silverstein is a licensed clinical social worker who supports families and specializes in children aged 0 to 3. She explains how a child's developing brain creates neural connections.
When we have repetitive activity that comes in predictable patterns, it reinforces that wiring, and the most used areas of the brain become the most developed. When it comes to early childhood trauma, that is really important because when children live with fear, when there is traumatic experience in their house, when there's domestic violence or there's child abuse, those areas of their brain that control the fear response get hyperdeveloped. They get really good at being afraid, right? And at being reactive and protective around fear. On the flip side, one thing that often doesn't get talked about nearly enough when we talk about trauma is neglect. So when children, maybe they don't have anything to be afraid of, but they're not getting the right amount of relational interaction. They're not getting all those beautiful moments where mom comes in and swoops them up, or dad or auntie comes in and swoops them up and locks eyes and coos together, and they have this really beautiful relational experience. When they don't get that, then the areas of their brain that control things like social bonding and empathy are underdeveloped.
When we experience a dangerous event, we have a fight or flight response. Our bodies prepare us either to fight a threat or run from it.
Well, imagine you're walking in the forest and you see a bear. Immediately, your hypothalamus sends a signal to your pituitary, which sends a signal to your adrenal gland that says, release stress hormones, adrenaline, cortisol. And so your heart starts to pound, your pupils dilate, your airways open up, and you are ready to either fight that bear or run from the bear. And that is wonderful if you're in a forest and there's a bear. But the problem is what happens when the bear comes home every night. And this system is activated over and over and over again. And it goes from being adaptive or life-saving to maladaptive or health damaging.
In child A's world, adults are unpredictable and threatening. Child A's stress response system is going to be turned on almost all the time because they are constantly protecting themselves from danger. This is called a toxic stress response. Child A stays aroused and hypervigilant with stress chemicals in their body. In child B's world, adults are safe and supportive. Child B's stress response will only be activated when they feel scared or threatened. Their body doesn't keep them in fight or flight all the time because it doesn't need to. This is a healthy stress response. It will help the child to build stress tolerance and learn how to handle a stressful event in the future.
We now understand, better than we ever have before, how exposure to early adversity affects the developing brains and bodies of children. It affects areas like the nucleus accumbens, the pleasure and reward center of the brain that is implicated in substance dependence. It inhibits the prefrontal cortex, which is necessary for impulse control and executive function, a critical area for learning. And on MRI scans, we see measurable differences in the amygdala, the brain's fear response center.
Now let's look at child A and child B in a real-world context, school. In the classroom, children are expected to sit quietly and focus. Child B might have no problem doing this, but child A, who has grown up in an almost constant toxic stress response, will probably not be able to focus in class. The parts of their brain in charge of fear and reactivity are overdeveloped, and the parts that would help them stay calm and pay attention are underdeveloped. Child A has adapted to be reactive and impulsive as a survival mechanism. Brian Farraher is the executive director of the Hannah Boys Center in Sonoma, California, a residential treatment center for at-risk boys.
So a lot of what we see with our kids is their behavior is actually really adaptive to some hard situations they've grown up in. So if you're, for instance, if you're very volatile, it keeps people at bay. It protects you. Right? So for a lot of our kids, their behavior in the context of maybe how they've grown up makes a lot of sense. And then they come into a treatment environment like ours here, and people kind of go, well, they're safe here, everybody's nice to them or whatever, but that's not their life experience. And so we have to understand context for these kids.
Now we know what happens to brain development when a child experiences adversity and how that affects behavior. But how does adversity lead to negative health and social outcomes, as the ACE study showed? Earlier in the program, we talked about how participants in the ACE study with 4 or more ACEs were several times more likely to develop negative health and social outcomes than a person with 0 ACEs. You can see some of those health and social outcomes here. But how do we get there? How do we get from a high ACE score to liver disease, to coronary heart disease, to obesity? Having a high ACE score increases the risk of mental illnesses like anxiety or depression. And the toxic stress response affects the areas of the brain in charge of impulse control and judgment, as well as the pleasure and reward center. So it makes sense that someone with a high ACE score would be more likely to engage in high-risk behavior as a way to cope with that anxiety or depression. How would a child, like child A, cope with anxiety or depression? Salvador Sanchez Strawbridge used to be in a gang during his childhood. Now, he's the community outreach specialist for the Santa Rosa Violence Prevention Partnership. He explains how he coped with his unaddressed trauma as a child.
In my childhood, I had some traumatic experiences, and because I didn't know how to deal with those situations in my life, throughout my life, I put things inside of me to make me feel better. So first it was candy and toys and things like that, and then it was gangs and girls and drugs. Gangs are wraparound services based on conditional love. They literally will give you a false sense of everything you don't have. If you don't have, for me, I was half Irish, half Mexican, so I didn't understand who I was. I didn't have identity, so they gave me identity. You're gonna be part of this so you can feel okay. That I can be okay because I'm scared, I'm alone, I'm in fear, I don't want to be picked on, I want to be powerful, I want to be somebody, I want to be seen. A lot of kids don't feel like they're seen. These kids are joining gangs because they lost hope, because there's something that's not right for them. They don't feel that anybody cares. They've lost hope on society. The jobs that they see are jobs, not careers. The school system that they go to doesn't tell their history or where they come from, or has anybody that looks like them in their books. So they can sense it. They can sense that the society doesn't care about them.
This explanation can also be applied to other coping methods, like smoking or intravenous drug use. Smoking is a way of self-medicating that decreases feelings of anxiety and depression. You can see in this graph that the more ACEs someone has, the more likely they are to smoke, and the more likely they are to develop lung disease. And HIV can be transmitted through intravenous drug use, another way of self-medicating. More ACEs means someone is more likely to use intravenous drugs as a coping mechanism, and more likely to develop related health problems. So, if someone smokes, uses drugs, or engages in gang activity as a way of coping with trauma, with all factors considered, these are actually adaptive behaviors. They are available solutions to the difficulties that accompany adversity.
But it turns out that even if you don't engage in any high-risk behavior, you're still more likely to develop heart disease or cancer. High doses of adversity not only affect brain structure and function, they affect the developing immune system, developing hormonal systems, and even the way our DNA is read and transcribed.
High doses of adversity affect how our DNA is read and transcribed? What exactly does that mean? DNA is in our cells. It's the blueprint for who we are. We receive half of our DNA from our biological mother and half from our biological father. And DNA is made up of genes, sections of DNA that have specific instructions for cells. These instructions tell cells what to be and what to do. Here's where ACEs comes in. Recent research indicates that stress can actually influence how cells read those instructions on our genes. And this can negatively impact how our cells work. And because DNA is passed from biological parent to child, these changes to our genes can be passed down from generation to generation. Genetics can shape a child's development, but the adults in their environment can too.
We are the stress regulation system for those infants, right? When we're distressed, they feel it, they get hyper-aroused. When we're calm, even when they're upset, we can calm them down. And the impact of any event is going to be determined by the reaction of the caregivers. So the kid runs, the kid slips and falls, scrapes a knee, and mom says, "That's okay, you're all right, let me give you a hug and a kiss." And it's no big deal. The kid runs, falls, scrapes a knee, and mom says, "Oh my goodness," right? And the kid's hysterical for 10 minutes, right? It makes a really big difference.
Dysregulated adults tend to raise dysregulated kids. So I think if we can help adults to, again, make choices, to better manage their emotional world, to better regulate themselves, they will inevitably become better parents. And I really believe that everybody loves their kids and wants to do best by their kids. So So I think the more we can support adults to become better parents, to understand that what's happened to them is, they're not bad people, they're not sick people, they're injured. And so if they can better understand what the impact of those injuries are in their lives, then they have an opportunity then to make different choices and to find different solutions. They're not trapped by what happened to them in the past, but can make choices about what they want to be in the future.
We hold great potential to prevent the multi-generational effects of adversity. Even if a child grows up in a stressful environment, if they have a loving support system somewhere, then they can cope with and recover from trauma much more easily. And in turn, they can prevent the effects of their trauma from being passed to their children. But where do we start? How do we build resilience against the effects of adversity? There are 3 protective systems we can use in our communities. The first protective system cultivates personal capabilities. When a supportive network nurtures someone's positive self-image, self-efficacy and skills, and their ability to regulate their emotions, it can encourage them to use their own capabilities to be resilient.
My therapist and the people that helped me said it was okay to be where I was at. I felt accepted by them. I didn't feel ashamed of my past. I didn't feel ashamed that I was in my late 20s, getting sober and finally dealing with my issues, or turning 30 in rehab. They gave me a safe space. My therapist was she was full of humanity. She was a white woman that was upper middle class and a lot older than me. We didn't have a lot in common, but we had in common that she cared about my well-being, and she expressed it, and she stood with me. And for that, I was able to, because she couldn't do anything but help me heal myself. You can't put a wand on somebody you're healed, So for me, I had to do it. I had to decide to walk through that, and she created that safe space for me to walk through that and to just and to express all this feelings and emotions that I never dealt with till I started to confront my trauma.
The second protective system promotes belonging. It's important to nurture relationships with caring individuals who are trauma-informed. Meredith Kieschnick is a pediatrician for Santa Rosa Community Health Centers. She explains the difference that a caring, attentive healthcare provider can make for someone who has experienced trauma.
The things that help the most are relationships, healing relationships. So if a provider just kind of blows you off, my mother was an alcoholic, and it's just oh, okay, right? You're not really gonna tell your story again, are you? You're not gonna say, oh, this is a great place, they're really paying attention to me. It's more likely that you're gonna shut down, withdraw, and maybe not come back for care. Whereas if a provider is really proactive and say, listen, I see that you have this history, and I'm really concerned about that, because that can have long-term effects upon not just your health, the health of your children, right? The health of your family. Let's sit and talk about that and see what we can do and what would work for you to heal from this. It's a big difference, right? People are more likely to come back and engage.
The third protective system fosters self-healing and thriving communities. Fostering thriving communities is about empowerment. It's about investing in the people who have the most at stake so they can be the expert leaders of their own community's change. Self-healing communities are made up of local leaders, people most affected by adversity, people who are dedicated to community members, and people who can offer help and resources. And external partners, individuals or organizations from the outside who maintain a relationship with the community and provide assistance when necessary. Together, partners can engage in dialogue, make changes that the community wants, and improve quality of life, all while keeping focus on the community and the people. Oscar Chavez works for the Sonoma County Department of Human Services and is committed to building unified communities.
In thinking about resiliency, it's not about us trying to fix a group, and in fact, I would challenge us, and I would say that we have so much to learn from people who have been dealing with resiliency for thousands of years and who know what it means to have high level of trust and cooperation and mutual aid and benefit. In fact, I think we've lost that in our country because of this, deeply rooted belief in the individual, that we no longer value the importance of community. We have the potential to think differently about how we're organized as groups and how we build trust amongst groups and how we set the table to bring more voices to this important conversation, because the more we know together and the more we build together, the more trust we can have. And when we have trust, we can get things done.
The ACE study pyramid is about adversity in our immediate home environment. But this alternative pyramid, made by the RISE Center, acknowledges adversity within a wider social and historical context. We can't talk about adversity and trauma without talking about systems of racism, equity, and social injustice that shape our environments before we even come into the world.
Change requires risk. So if we don't take some risks with our kids and take some risks with our organizations, then we're not really promoting change, because you can't change and not risk. It's just, so often that's the real rub is, well, something bad will happen, and the opposite of that is nothing will happen, right? And that's not what we want. We want something to happen.
We do want something to happen. We want to improve the lives of our children, parents, and friends. We want to strengthen our communities. We want to heal.
This is treatable. This is beatable. The single most important thing that we need today is the courage to look this problem in the face and say, this is real and this is all of us. I believe that we are the movement.